Hello class, today we're going to talk about chronic bronchitis. And chronic bronchitis is defined as inflammation of the bronchi. And if you remember our medical terms, we know that chronic is something that happens over a long period of time. And bronchitis is inflammation of the bronchi. So inflammation of the bronchi over a long period of time. And chronic bronchitis is also a chronic obstructive pulmonary disease. So I'm just going to draw a little example of two bronchial tubes just to help you understand chronic bronchitis better. So here we have one, the other. We're just going to label these tubes. So it's going to be our normal tube. This one's going to be our tube with bronchitis. So our normal tube will look something like this. And our one bronchitis will look something like this. So we see that this tube is very dilated and you can breathe pretty well out of this one. So we move over to the tube with bronchitis and we notice that it's very constricted and it's going to be really hard for someone to breathe out of that tube. And we also notice like some stuff coming out of it, and that will be our mucus. And we're going to talk about one of the major causes of chronic bronchitis, and that would be smoking. Now, smoking isn't the only thing that causes chronic bronchitis. We also notice this in people who live in places that are very polluted, and also people that work in environments that are very dusty or have a lot of gas. So we're going to move on to some symptoms that you'll see in someone with chronic bronchitis. We're just going to make a little list. Okay, now we're moving on to our symptoms. So we're going to notice quite a few things in people who have chronic bronchitis. And that's going to be our major one. It's going to be coughing. And it's not going to be any regular cough. We're going to notice a cough that's very productive, which means they're going to have some mucus and sputum coming up with that cough. And we're also going to notice that our patient is very fatigued and has shortness of breath and some chest discomfort. And we're also going to notice cyanosis. That's a blue color. And we're going to notice this because the lack of O2 that the person is getting due to their bronchioles being so constricted. And some symptoms are very severe, and our patients should know to call the doctor if they're experiencing any of these things. So one of the major things is a fever. If our patient has a fever, we want them to go ahead and call the doctor because we don't want anything else to be wrong. And also with the cough. If our patient is coughing up any blood with their sputum and blood in their mucus, we want them to go ahead and call the doctor just because we don't want anything else to be wrong. Okay, the last thing we're going to talk about is treatments or medications. So the first thing we have on our list is O2 therapy. And this is needed for patients whose symptoms are more severe. O2 will help with patients who experience difficulty in breathing on their own. Next, we're going to talk about bronchodilators. And everyone should be familiar with these because we learned about these meds in pharm. These are going to help to open up your bronchioles and just help you breathe better. And last, patients that are experiencing chronic bronchitis may be on antibiotics, and these are just to prevent any respiratory infections that may occur.